to be talking about the British communication style, so I'm very excited about this, and hopefully this will be very insightful and very helpful for you too. My name is Rachel Dexter. I founded Healthy English in early 2019, and my background, as Julie said, I worked in the NHS for 12 and a half years as an occupational therapist in the hospital setting and community settings as well. And I've lived and worked abroad as well. I've lived and worked in parts of Africa and also in Europe, and currently living in Denmark now. And I think the reality is that as a medical or health professional, when you move into a different culture, a different country, a different system, knowing the language to a high level is not enough to really thrive within that environment. And when you step outside of your culture, you start to realize, wow, British people are confusing. So what's that like then for people coming in to work in this system that haven't grown up in this culture? So in this session, we're going to look at a few things. First of all, we're going to think about why is it important to understand how British people communicate. We're also going to look at 4 key insights today into British communication. Now, we're going to think about within those insights, we're going to always be thinking, well, what are the implications for my practice? How can I? And we're going to think about at the end how you can move forward with Healthy English. I'm going to talk briefly about my course. When I say that British people are polite and indirect, this does not apply to every single situation, because I've had people say to me, well, if I'm in an emergency situation, okay, my patient's crashed, do I have to say, oh, please, could you just pass the adrenaline? Or no. In an emergency situation, it is totally appropriate to be very direct and very clear. You need to just communicate the important information in handovers. So there are these situations where it doesn't apply, but in pretty much every situation, the British people are polite and indirect. Now, you might be laughing and think, oh my goodness, that's just, why do we have to say all these extra words? And yes, it can be frustrating if you come from a culture where you communicate directly, and that's fine. The problem is, if we apply a very direct way of communicating, so if you apply your direct communication style in the UK, you will come across as rude. And this is what doctors have found again and again. They're told, you need to improve your communication, but they don't know how. The other way that this can manifest is in conflict avoidance. So related to this politeness and this indirectness, as a generalization, British people go out of their way to avoid conflict. So they will try and keep discussions polite at all times. And sometimes they'll make vague statements to soften what they really mean. So maybe you're in a meeting, or they say, oh, I hear what you're saying, but, and again, it's this polite way of disagreeing. So what they're really saying is, I disagree with you, but we wouldn't say that. We wouldn't say you're wrong, I disagree. It's too rude, it's too direct, we don't want to cause conflict. So we use this soft phrasing. It's an interesting point, however, or I do hear what you're saying, but from my perspective, okay, and this is how we often deal with conflict. This is really, really important, understatements. So again, this ties into the indirect nature of British communication. So we don't like, as British people generally, to clearly state the severity of a situation or to speak in a dramatic way. We're not one on showing big emotions, we're not one on being over dramatic. We're not one on being honest about how much we're struggling in a situation. I want to give you some examples of some typical understatements. A bit, a little, quite, somewhat, a tad. So in their literal translations, all these words mean a small amount. But a lot of the times when British people use these words, we actually mean the opposite. We actually mean a lot, but we don't like to say that. We don't like to kind of show that we're being dramatic and that we're not coping in a situation where it's really severe. The implication is that you need to listen with your eyes. As a doctor in the UK, you need to listen with your eyes. Now, what do I mean? There's a great quote that says the most important thing in communication is hearing what isn't said. Now, what does this mean? Yes, you need to listen to what your patients are telling you verbally. This relates to colleagues as well. But we also need to listen to what they're telling you non-verbally. And we have to holistically listen to your patient, particularly in the UK, because we cannot always rely directly on what they're telling us verbally. Some of the topics you need to kind of stay clear of that will make people feel uncomfortable if you don't know them very well are things like this: your salary, or people's salary, their wealth, their weight, commenting on their age is another sensitive topic. Personal appearance. You need to be really careful about commenting on people's personal appearance. Religion, marriage and children. So these are kind of topics that you want to avoid when you don't really know your colleagues very well. British are often self-deprecating. Okay, so what does this mean? I think this is self-deprecation is important to understand because it comes into a lot of communication. And the final insight I want to talk about today is humour. So in British communication, humour is often a part of most conversations. And I think this is important to understand because in other countries and cultures, there's a time and a place for humour. If there's one show that you go away and watch, I would watch this show, Very British Problems. So Very British Problems is a great show to get to. So they interview, so they have on the show lots of different comedians, lots of different presenters from all around the UK. So you get all the accents as well to tune into. There's a lot of humour. And what they're making fun of is British people and culture and the Britishism, the kind of silly things that British people do. So it gives you a lot of insight about culture, a lot of insight about humour, and the historical stories that explain why British people might act in a certain way or why British people might communicate in a certain way.